Explain in detail the physiological changes during pregnancy. This is most expected long essay for 15 marks as per new RGHS syllabus. Physiological changes during pregnancy. You have to answer in this format to get the full marks of 15. First one, definition, it carries 1 mark. Pregnancy is a physiological condition in which anatomical, physiological, biochemical, and hormonal changes occur in the maternal body to support fetal growth and prepare the mother for labor and lactation. Classification of physiological changes. If you list this, you'll get 1 mark. Physiological changes occur in reproductive system, cardiovascular system, hematological system, respiratory system, renal system, gastrointestinal system, endocrine system, musculoskeletal system, skin, breast, metabolic system, and nervous system. Coming to the respiratory system changes, since it is a major changes which are happening during the time of pregnancy, so it may carry 2 marks. So coming to the first one, uterus, weight increases from 50 grams to 1000 grams, capacity increases from 10 ml to 5000 ml, shape becomes globular, position shifts from pelvic to abdominal cavity, and Braxton Hicks contractions will be present. Cervix, softening of the cervix, which is also known as Goodell's sign. Bluish discoloration will be seen, which are called as Chadwick sign, and also formation of mucus plug will be there. Coming to the vagina, there will be increased vascularity, increased elasticity, and increased discharge, which is also called as leukorrhea. Ovaries, there will be stopping of ovulation, and corpus luteum secretes progesterone initially. Next system is cardiovascular system. It carries 1.5 mark. Blood volume increases by 40 to 50%. Cardiac output increases. Heart rate increases by 10 to 15 minutes per minute. BP, that is blood pressure, slightly decreases in second trimester, and venous pressure increases in lower limbs. Supine hypotension syndrome also may occur. Hematological changes, this carries 1 mark. Plasma volume increases and RBC count slightly increases. Physiological anemia may occur. Hemoglobin decreases slightly and WBC will be increasing. Clotting factors also increases, and the purpose of this is it prevents in hemorrhage during the time of delivery. Respiratory system changes, this also carries 1 mark. Oxygen consumption increases, tidal volume also increases, diaphragm elevates, chest circumference increases. Mild breathlessness is common during the time of pregnancy, and the main purpose is to meet fetal oxygen requirement. Renal system changes, this carries 1 mark. Renal blood flow increases, glomerular filtration rate increases, and frequency of urination increases, dilatation of ureters, and also risk of urinary infection increases. Gastrointestinal system changes, this also carries 1 mark. Morning sickness will be there, nausea and vomiting, thylism, heartburn, constipation, decreased gastric motility, hemorrhoids may occur, and the cause for this is progesterone hormone effect. Endocrine system changes, this carries 1.5 mark. HCG, it helps in maintaining corpus luteum, and estrogen, it usually stimulates uterine growth and breast enlargement. Progesterone helps in maintaining pregnancy and also relaxes uterine muscles. Prolactin, it helps in preparing breast for lactation. Relaxin, it helps in relaxing pelvic ligaments. Musculoskeletal system changes, carries 1 mark. It helps in relaxation of pelvic joints, and increased lumbar lordosis will be there. Backache is common during this period. Waddling gait will be seen. Increased mobility of sacroiliac joints, and the main purpose is it helps in facilitating childbirth. Skin changes or cutaneous changes carries 1 mark. There may be chloasma and linea nigra will be observed. Stria gravidarum will be seen. Hyperpigmentation of nipple and also areola, and increased sweating will be observed. Breast changes, this carries 1 mark. There may be enlargement of the breast and increased vascularity. Areola darkening will be seen. Montgomery tubercles also appears. Colostrum secretion will be there, and the main purpose of this is preparation for lactation. Metabolic changes, this carries 1 mark. Basal metabolic rate increases, weight gain occurs, increased protein requirement is seen, increased iron requirement is seen, and also calcium requirement and water retention may occur. Nervous system changes, this carries 1 mark. There may be emotional instability and mood swings will be observed. Anxiety, sleep disturbances, and maternal behavioral adaptation also observes. Coming to the conclusion, this if you write, you may get half to 1 mark. Physiological changes during pregnancy support fetal development and helps in preparing the mother for safe labor and successful lactation. So today's tip to write these physiological changes is write these physiological changes system wise with headings and also the values if it is present to score full 15 marks. This is a repeated RGHS university question which is expected to get even in new syllabus also. Thank you for watching.